Feeling tired all the time, gaining weight easily, or struggling with low energy? Your thyroid might be involved. Today, I'm explaining natural ways to support hypothyroidism, how levothyroxine should be taken properly, and why thyroid care during pregnancy is so important. Hypothyroidism happens when the thyroid gland doesn't produce enough hormones. This slows metabolism and can affect energy, mood, digestion, and overall well-being. The good news is that medical treatment and nutrition strategies can help support better thyroid health. First, focus on reducing added sugars and highly processed carbohydrates. Because hypothyroidism affects metabolism, excessive sugar may worsen inflammation and make symptoms harder to manage. Second, support your vitamin B12 levels. Low B12 is common in people with hypothyroidism and may contribute to fatigue and weakness. Foods like peas, cheese, milk, sesame seeds, and eggs may help support B vitamin intake. Third, include flaxseeds. They are rich in omega-3 fatty acids, especially alpha-linolenic acid, which may support hormone balance and help reduce inflammation. Fourth, ginger can also be helpful. It contains potassium, magnesium, and plant compounds with anti-inflammatory properties that may help support the body and reduce discomfort linked to hypothyroid symptoms. For many people, hypothyroidism is treated with levothyroxine, a medication that replaces thyroid hormone. The dose is adjusted according to symptoms and thyroid blood tests, especially TSH levels. It's very important to take levothyroxine correctly. Doctors often recommend taking it on an empty stomach at the same time every day. If you take it in the morning, wait about 1 hour before eating or taking other medications. If you take it at night, wait several hours after your last meal. Some supplements and foods may interfere with absorption. These can include iron supplements, multivitamins with iron, some antacids containing aluminum, large amounts of soy, and very high fiber diets. That's why discussing your routine with a healthcare professional is important. If you miss a dose, do not double the next dose unless specifically advised by your doctor. Thyroid health during pregnancy needs close medical follow-up. Women with hypothyroidism are often monitored carefully because hormone needs can increase during pregnancy. In many cases, doctors adjust treatment early and check hormone levels regularly. Proper treatment matters because unmanaged hypothyroidism during pregnancy may increase the risk of complications such as miscarriage, low birth weight, anemia, and problems with fetal brain and nervous system development. The key message is simple. Hypothyroidism should be managed with medical guidance, consistent medication use, and supportive nutrition. Reducing processed sugar, supporting B12 intake, including flax seeds and ginger, and taking levothyroxine correctly can make a real difference. If you have symptoms of hypothyroidism or are pregnant and managing thyroid issues, speak with your doctor for a personalized plan. Which thyroid support tip did you find most useful? Share in the comments and follow for more simple, evidence-based health content.